The inferior alveolar injection is essential to understand and perform competently. Because the mandibular alveolar bone is much more dense than the maxilla, anesthetic solution cannot penetrate it. Consequently, the inferior alveolar nerve must be anesthetized before it penetrates the bone. This injection is used to anesthetize all the mandibular teeth. The inferior alveolar nerve is a branch of the mandibular or third division of the trigeminal nerve. This division of the trigeminal nerve exits the middle cranial fossa via the foramen ovale. It descends inferiorly through the infratemporal fossa, where it divides into an anterior and posterior division. The anterior division gives off one sensory branch, which is the buccal or long buccal nerve. The posterior division gives off several sensory branches, including the inferior alveolar and lingual nerves. The buccal nerve descends in a lateral direction and crosses the anterior border of the ramus, approximately at the height of the mandibular occlusal plane. It then courses anteriorly in the buccal vestibule, providing sensation to the soft tissue on the buccal aspect of the first, second, and third molars. The lingual nerve descends between the medial pterygoid muscle and the ramus of the mandible until it reaches the base of the tongue. It then courses anteriorly, providing sensation to the anterior two-thirds of the tongue, the floor of the mouth, and the lingual gingiva of the mandibular teeth to the midline. The inferior alveolar nerve travels inferiorly and laterally between the ramus of the mandible and the medial pterygoid muscle. It enters the mandible at the mandibular foramen and continues to course anteriorly to the midline. While in the mandible, it provides innervation to all the mandibular teeth and the associated buccal and lingual bone. Approximately at the second premolar, it gives off the mental branch, which exits the mandible via the mental foramen. The mental nerve provides sensation to the labial soft tissues from the premolars to the midline. It also provides innervation to the chin and lower lip. The target site for this injection is the inferior alveolar nerve just before it enters the mandible. The mandibular foramen is located midway between the anterior and posterior borders of the mandible. The height of the foramen is approximately 1 centimeter above the mandibular occlusal plane. The client is semi-supine with the mandibular incisors perpendicular to the floor. The right-handed operator sits between 9 and 10 o'clock for the left inferior alveolar injection and between 8 and 9 o'clock for the right inferior alveolar injection. The intraoral landmarks for this injection are the pterygomandibular raphe, the coronoid notch, and the maxillary and mandibular occlusal planes. Request the client to open their mouth as wide as possible. Firmly retract the cheek with the thumb or index finger on the coronoid notch. This facilitates identifying the raphe, which is a band of tissue that begins just behind the last maxillary molar in an arc and terminates in the retromolar pad distal to the last mandibular molar. Just lateral to the raphe, there is often a shallow depression or fossa, which feels soft and spongy. This depression is approximately 1 centimeter above the occlusal plane, or halfway between the maxillary and mandibular occlusal planes. Prepare the syringe with a 25 gauge long needle. Bevel orientation for this injection is not critical. Apply topical anesthetic for 1 minute. Insert the needle and advance 20 to 25 millimeters until bony contact is made. Withdraw the needle 1 millimeter, aspirate, and deposit 1.5 to 1.8 milliliters of solution. Bony contact is essential to ensure the needle has not been advanced posterior to the ramus. This is the location of the parotid gland and the facial nerve. Injecting anesthetic into the parotid gland capsule could anesthetize the facial nerve, which is the motor supply for all the muscles of facial expression. Instead of anesthetizing the teeth, temporary unilateral facial paralysis would result. The lingual nerve can be easily anesthetized at the same time as the inferior alveolar nerve. After depositing the anesthetic for the inferior alveolar nerve block, withdraw the needle approximately half its length, perform aspiration, and deposit a small volume, approximately 0.1 to 0.3 milliliters of anesthetic solution.